Hey, and welcome back to another episode of Burning Questions. My name is Melvin Robinson, Executive Director of the Mississippi Cannabis Trade Association, and this is the Mississippi Cannabis Trade Association weekly podcast that we do about the Mississippi cannabis trade industry. Thank you all for watching. We are back. This is season two. We took a quick break to make sure we could get some stuff together, but now we're on season two, bigger and better than ever. And yeah, I'm glad you all are here and you all are watching. Don't forget to subscribe on YouTube. Don't forget to like us. Excuse me, on Facebook. And also, every Wednesday, you can catch this previous episode on all your DSPs. So that's your Amazons, that's your Spotify's, that's your Apple Music. You can catch those there. We're going to go right into it, and we're going to talk about some of the things that we have going on. This week, it is Lucky Leaf Week. So, Lucky Leaf Expo, they are having their cannabis convention in Jackson, Mississippi, October the 7th and the 8th, right here in Jackson. We're going to have over 100 exhibitors, going to hear from a variety of speakers and more at the Lucky Leaf Expo. Also, we actually partnered with Lucky Leaf to bring you all a very special event. We're going to be hosting a social mixer. So we partnered with Lucky Leaf and Weed Maps. Shout out to both of them for the social mixer after the first day of the Lucky Leaf Expo. It starts at 5:30 at Hallamals. So once you leave the expo, you can go right down to Hallamals. You can drive that short way if you want to. You can walk down. It's like 3 blocks away. And yeah, join us. It's going to be a community event. It's completely free. And also, if you bring your Lucky Leaf badge or your Lucky Leaf ticket, you get 2 free drink tickets. So make sure you bring those badges. Make sure you bring those tickets. Come hang out with the Mississippi cannabis industry, and let's have a good time. Also, I want to talk about our partnership with the Mississippi Cannabis School. The Mississippi Cannabis School here is providing workforce development training for the Mississippi cannabis industry. And if you decide to become an individual member of the Mississippi Cannabis Trade Association, this offer is for new individual members. If you decide to become an individual member, you get a $150 credit towards your next class at the Mississippi Cannabis School. So you can just visit MississippiCannabisSchool.com to learn more information about that and go from there. All right, so we have paid the bills, as they used to say on the radio. I'm going to bring our guest over tonight. There we go. All right, so as we do on Burning Questions, we always allow our guests to introduce themselves because no one can quite introduce yourself like yourself. So if you would, sir, please go ahead.
I concur with that. Thank you for having me on Burning Questions. My name is Dr. Kency. I'm an emergency medicine doctor trained, but I do medical marijuana certifications here in the Jackson area, specifically in Ridgeland, Mississippi. A little bit about myself. I'm from Jackson, Mississippi. Went to Provine High School, center of Jackson. Attended Alcorn State University, 4 years biology major, graduated. Attended medical school at the University of South Alabama in Mobile. Shortly after graduation from medical school, went into the United States Navy, where I served as a general medical officer with the Seabees down in Gulfport. So I know a lot about the Gulf Coast cities as I was stationed down there for 4 years. Did some deployments, mainly to Africa with units in Europe and Guam and kind of all over the place. Once I finished up my military tour, I came on back home, studied emergency medicine at University of Mississippi. Amazing time, learned a lot of stuff, lots of trauma, lots of just really sick people. Garnered my love for medicine was still there, and since then I've been practicing at emergency medicine locations throughout the city, Brookhaven, Macomb, Meridian, kind of all over the place.
Oh yeah, oh yeah. Hey, so you went to Provine, and we had talked about that. Long way from the West Side, man.
Long way, long time and long way.
Oh yeah, oh yeah, oh yeah. All right, so I want to thank you for coming on today and everything like that. So long time medical professional. Really glad to have you on. We had Dr. McIntosh on our first season, our first episode. So now we have another medical professional on our second season, our first episode. So yeah, thank you for coming out and everything like that. We really enjoy it. All right,
Thank you.
so oh yeah, so we're going to get right into it. You are certifying patients for the Mississippi Medical Cannabis Program here, correct?
That's correct.
All right.
And then I want to be very clear about the difference between certification and a prescription. We don't give prescriptions, right? A prescription is what I give a patient that I see in the emergency room. I find a diagnosis. I see that you need a medication. I write you a prescription. The pharmacist allows you to fill that prescription for that reason. When it comes to medical marijuana, the state has already said that you can have it. They wrote the law that says that you can have this, but to have it, you have to have this certain, or you have to have a qualifying condition. That's what I do. I tell the state of Mississippi that you meet the requirement that they've already set, and I certify by my medical expertise, my medical knowledge, that you, or based on my consultation with you and review of your medical documentation, that you have one of the 22 qualifying conditions. And that's all I do. I say I reviewed the medical record. Yes, ma'am, she has cancer, or yes, state of Mississippi, she has cancer. She has intractable nausea, vomiting. He has multiple sclerosis. He has dementia with agitation. Once I do that certification, it goes into your portal, and then your application is your application.
Oh yeah, oh yeah, yeah. And that's one thing that we really wanted to hammer on, and we've been telling people like it's not a prescription; it is a certification. You are certifying that this person has this condition.
Correct.
All right, so let's do this. Let's go step by step. If someone says, "Hey, you know what? I want to get a medical cannabis card," and they say, "I saw this Fred Kency guy, Dr. Kency. I want to make sure he can get me. He can get me in there." What's the process of getting certified by you?
So certifications with Kency Medical Services. So we have a website, KencyMedicalServices.com, KENCY medicalservices.com. What you'll do if you go on our site, it tells you literally step by step how to take care of it. But what you'll do right under my picture on our website, there's a button that says Contact Us. When you click that button, it's going to ask you for some specific information. That information allows us to enter your information into our medical portal, our electronic medical record. That's one of the requirements that the state places on us as physicians, that we must maintain a medical record for every single person. And so that's how we do it. You click that Contact Us button. It gives us the information. We log into our medical portal, and then someone from our office will give you a call. When that person gives you a call, they're going to be sending you a couple things. One email is going to be telling you that we need your medical records. One email is going to tell you how to log into our electronic medical record so that you can import those things. Things like a driver's license, things like a HIPAA compliant form, things like the risks and benefits of medical marijuana, things about the kind of state required details that the state tells us that you must tell every patient that they must know these things. After you do that, I will review the medical records in the computer. I don't want anybody to pay for something and then I not be able to give them the product that they're paying for. Okay. So we don't charge you anything until we know that we can do that certification for you. At least you have the qualifying condition before we get you into the clinic, because it must be an in-person evaluation or in-person consultation. So first thing is visit the website, give us your information. We call you, we get your medical records, whether you have them in your hand or we give you a medical release for you to get your clinic or doctor to send those forms by fax to us. Either way, we get your medical records. I review those medical records. If we determine that you have a qualifying medical condition, one of the 22 qualifying medical conditions, we will set you up an appointment to come into the clinic. Right now, we're doing about 2 or 3 days a month. As the volume picks up of patients who are signing up, we'll increase those days. But right now, we're pretty much filling up about 2 or 3 days a month, and we're doing pretty good with that. What'll happen then in the inpatient consultation, we'll have a discussion. You'll have to get a urinalysis to get a urine drug screen. That's required by the state. The biggest question is THC in my urine going to disqualify me?
I was just about to ask that. I was just about to ask that.
The answer is no. And what it does for me is that it tells me that you've already been using THC. You know that it already has some medical benefit for your problem. So you're already telling me that, I want to go from, having this illegally to having this legally to treat my medical condition. And that's just what that does for me. Obviously, it does test for more than just THC. It tests for opioids. So we pull what's called a PMP, a prescription monitoring service. That's a state application that we have that tracks all controlled substances that anybody buys. So if you have opioids in your system, they should be consistent with what's on that PMP. It tests for amphetamines, methamphetamines, cocaine, things like that. If you take Adderall and it's on that control system, if it shows up in that urinalysis, then you're fine. You don't have anything to worry about. But the biggest question I get is, if I have marijuana in my system, am I going to be disqualified? The answer is no. Okay. You get the urinalysis, the urine drug screen done right there in our clinic. And then we sit down, we talk, we discuss risk benefits, we discuss your diagnosis, we discuss the doctors that you see. Even though I do the certification for THC, I make it very important to have a discussion with the patient that your primary care doctor is still going to be your primary care doctor. So you need to have a discussion with your primary care doctor about using THC, because there are some doctors who agree with it, some doctors who are, ambivalent. They don't really care. If you use it, you do. If you don't, you don't. Some doctors are just flat out against it. And I don't want you to come to me to get started on medical marijuana, and then now you have a primary care doctor who prescribes you, whether it be Ambien, whether it be something for chronic pain, whether it be something for anything, and now you do a urinalysis in their clinic and it comes back THC, and now they won't take care of you anymore. So we want to make sure that there's a clear discussion with your primary care doctor first to say, hey, I'm thinking about using the Mississippi Cannabis Program. Are you okay with that? Okay, make sure that discussion is very clear with your primary care doctor. I've had a few patients say, if my primary care doctor ain't cool with it, I'm going somewhere else. Totally understandable.
Yeah.
That needs to be a discussion with your primary care doctor first. Because I don't want you going weeks or months without being able to get into a doctor because you chose, cannabis over, Dr. Jones. And so once we're done in the clinic, before you leave my clinic, I've already inputted your information to the Mississippi Department of Health's website. I'll give you a piece of paper before you leave the clinic that tells you how to go into their system, the Mississippi Department of Health's website, the Cannabis Registration Program, to put in your information, how to pull my certification over into your application. And I'll walk through kind of the things that I've seen that get people kicked out. By kicked out, I mean application rejected. And the most common thing is the photo. They have a very specific way that they want the photo done. They want it just like a passport picture, but you can't take a picture of a picture, okay? You can't have anything distracting in the background, like back here behind me. You can't have, your sunglasses on. You can't have a hat on. And most importantly, before you submit the picture, it must be put into a square, okay? So when you take a picture from your cell phone, normally it's going to be more of a rectangular shape. If you submit that rectangular looking shape to them, it's going to get out. They're going to reject it. And so, the painstaking part of it is that the department has 30 days to respond to your application. That means that you submit your application on the 1st of October, and generally they have until October 30th to give you a response. And obviously, as long as nothing's wrong with your application, it's going to be approved because the state has already said that you can have this. The only thing they're waiting on is, say, a doctor's certification that says that you actually have the qualifying condition. Okay.
I think a lot of people don't look at it that way. They think, hey, I gotta go and get this exam and everything. But if you're bringing medical records for a condition like
Mm-hmm.
cancer or something, you obviously
Mm-hmm.
have it if you have medical records for it.
Exactly.
Yeah.
Exactly. The state has already said that you can have the product. You just have to show a physician who certifies that I have it so that they can give you the certification. That's it. I mean, it is that simple. There's not a special exam or any kind of long, lengthy discussion. I'm gonna tell you the risks and benefits of cannabis. I'm gonna tell you that federally it's still illegal. That if the DEA or the FBI were to pull you over, could they arrest you for possession of THC? They could. But if the DEA or the FBI pull you over, you got bigger problems than
You got
cannabis.
bigger problems. And that's what I tell people a lot when they ask me things about like a gun and everything, and I explain to them how we have language in the bill about that and everything. And I'm like, hey man, if the FBI is kicking down your door, they're not going to do it because you got an ounce on your table. Like
Exactly.
it's not.
Exactly.
Yeah.
Exactly. I tell them, I preach that to them all the time. Like you're gonna be fine.
Yeah.
Once once I do my part, you can go into the Mississippi Department of Health's website, and if you haven't already started, you can finish your application. That means putting in your information, pulling across my certification, uploading your picture. Must be a square, nothing in the background, no shades, no hat. That's the one thing that'll kick you off.
Think
What you don't want to happen, say it again.
think about a passport picture.
Exactly, exactly. What you don't want to happen is that you put in that application with a bad picture. They take 28 days to get you approved, and then they reject your application because of your photo. Because you know what happens to your application when they reject it and tell you that you must resubmit your photo?
Goes back to the bottom of the line.
Resets that clock to 30 days. So don't take 2 months to get your stuff done. Once I do my certification in the clinic, you have 60 days to submit that application to the Mississippi Department of Health. Once that 60 days is up, that my certification drops off, and I have to let to redo the process, or I have to redo my side of it again in order to get you recertified. Okay. Once you submit your application, 30 days, most people are approved on the first try as long as that photo's right, as long as that proof of residency is right, as long as that driver's license picture is correct. Those are the three things that they're going to want you to submit. 30 days later, you'll get an email saying that you've been approved for your card or you've been denied, and they'll tell you why, what you need to resubmit. And then immediately after, at least until the first dispensary opens, you'll get another email saying your card has been deactivated. And they're just deactivating the cards until the actual dispensaries are open. That's just all that is. Once they all open, you'll get another email saying they've been reactivated and everything will be copacetic.
Oh yeah, oh yeah. So fairly simple process. How much
Mhm.
does it cost to come and see you to get certified?
So my clinic, KencyMedicalServices.com, KENCY, KencyMedicalServices.com. We charge 165. That 165 is going to include getting you into our medical records, getting reviewing your medical records, doing urinalysis, the drug test to make sure that everything is fine to meet the state requirement. Your 6 month follow up, which can be done however your provider does theirs. Some people are going to do them in person. Some people are going to do them a combination of video telehealth. The law kind of provides a little bit of laxity on the 6 month follow up. The 6 month follow up, per the state statute, is to assess how patients are doing with cannabis. Are you doing well with it? Are you having any issues? Do you have any questions, any concerns, any criticisms? What can we do to kind of make this better for you? Do you have any questions about dosing? Any questions about anything? And it's just to kind of get all those questions answered that 6 month follow up. And then what we'll do is we'll see them again in person for recertification. Anytime that I have to go into the Mississippi Department of website and do a certification, I have to physically see you in person. Anytime else that we just call, discuss, have conversations, obviously it can be by other means of telecommunication. We charge 165, and that covers all of that. And actually, this month, in observance of breast cancer awareness, we're actually doing a 10% off when you check out in the month of October. So it'll actually be 165 minus 10%. And you just use, when you do your checkout on our website, you'll see it, KencyMedicalServices.com. You scroll down, you'll see pay your fee. You put in the coupon code PINK, and it takes off 10%.
Right.
If you're a veteran, 15%. You put in US vet. So I'm a veteran. I believe in, giving back to my vets. So if you're a veteran, US vet, obviously you got to submit some paperwork that shows that you're a veteran. If not, we're going to ask you for the other 15% back. But as long as you got that
Double valor
documentation,
around here.
yeah, we're gonna be checking. We're gonna be
Yeah.
checking.
Oh
But
yeah.
as long as you got documentation that shows that you're a U.S. veteran, 15% off. So we're trying to do everything we can to get as many people certified as possible, because dispensaries, they're gonna be open soon, and they need customers, and obviously the patients, they need the product in order to help them with the medical condition that they have. And so we want to be sure that these people are ready when the doors open. They've been waiting long enough that they're ready to get in there and get it done. But that's from top to bottom, 165. It covers you for the whole year. When you come to do a renewal with us, it'll be cheaper. It's not 165. It'll be a little bit cheaper than that. If you did your first initial consultation with us, everybody's first initial consultation with us is 165. And when you do a recertification, it'll be lower the next year.
So just 165 flat fee. This is it.
165, that's it. And we don't touch your wallet again for 12 months.
Yeah. You know, look, talking to a lot of different providers, a lot of them were saying, well, not a lot of them, ones I have talked to, we're kind of deciding, I'm trying to still decide if I'm going to get into it or not. And it seems like you've kind of had 10 toes in, just jump in and do it. You've been, having your flyers everywhere, promoting really hard. Why did you decide to be so forward and open about participating in the program as a provider?
So a couple of reasons. I've actually seen and heard like so many stories about how cannabis has truly changed the lives of so many people, whether it be kids with autism that have having some agitation issues and how it gets them very calm, compared to putting these kids on like Risperdal and Seroquel and medications that can really do delirious things to them. Cannabis is one of our oldest drugs. It's been around since the beginning of time, and we know that it works. I've had fellow military folks with PTSD who literally will live by it. I mean, they can't function at work on certain SSRIs and certain antipsychotic medications coming back from some of these wars that kind of changed them as people, but they can completely function on cannabis. It lets them sleep at night without the horrible dreams, the horrible nightmares. And so when you see something that works as well as this works, and it has this stigma, whether the stigma is around the smell, whether the stigma is around just the culture that is notorious for using it, regardless of what the stigma is, just not a lot of people are going to get into it. Also, too, is that the getting this done is not easy on the physician side. I know it may seem like, because we have our program pretty streamlined now, and we can do it pretty effortlessly. I wouldn't say effortlessly, but it takes a lot of work. I have a great assistant that does a lot of the bulk of the work for us. But if I had to try to incorporate what we do into a clinic, if I was a primary care doctor and seeing patients for diabetes, hypertension, all that kind of stuff, if I had to incorporate this, urine drug screen, pull this PNP back, do this medical record review before the patient gets there, just so we can make sure that we can book them, it would really disrupt a normal flow of a clinic. Okay, that's why there are quite a few physicians who have clinics in town that are actually certified to do it. They actually went down to the Weston back in June, and
Yeah.
they got certified. They just haven't incorporated it into their clinics because it's not going to be easy. When you're seeing the number of patients you need to see just to pay the bills at your clinic, this kind of just bumps you back. It takes you a little bit longer, and that means you may have to get another staff member to help you just for this patient clientele. It can be literally that much work just for one other person.
Because I
Um,
want to ask you, how many people, like in a day, how many people have you certified in one day?
in one day, we usually do on our clinic days about 25 patients that one day. But there's so much work in the beginning. I over the 2 weeks before I actually see them in clinic, I've already reviewed their medical record. So I
Mm.
look at the medical record, I make notes in the chart to say reviewed medical record, VA medical record on this date, patient's psychologist, psychiatrist, health care worker was this name, blah blah blah. So I'm already doing record reviews throughout the week. So when the patient gets there, I can look at my notes, say, okay, this patient's medical record came from the VA. They're on this medication. They've used marijuana before. Pretty much, they walk into the clinic, give a urine sample. We check the urine sample, see what it looks like, and we just have a true, candid discussion. So I'm not sitting there doing a whole bunch of looking through records while the patient's there. You say, boom, you meet the qualifications. These are the risks and benefits. Do you have any questions for me? And then we can go to the next patient. Then I go into the Mississippi Department of Health's website, do their certification from there, and then next patient.
Well, cool. So we're going to wrap it up. You've been a great guest, man. Let the people know how they can contact you. Anything you want to let them know, just this is your time.
Definitely. So we're on all the social media networks: Instagram, Facebook, TikTok, Kency Medical Services, Kency, KencyMedicalServices.com. Go on our website, read through it, get our information. Ask us some questions, send us an email. We're happy to discuss anything. If you know someone who wants to participate in the program but don't have the funds, we actually have a gift card program where you can purchase a gift card for a veteran. You can purchase a gift card for a breast cancer survivor. You can purchase a gift card for a cancer survivor, and you can send them that gift card through our website. And that way, you can actually be the sponsor for somebody that wants to actually get into the program. Um, we have links on our website that can take you directly to the Mississippi Department of Health's website. So a lot of times people have had issues like, how do I actually get to the site to apply? Well, you come to our site, we got a link, and you click a button, you're done. The fees for all the different card types are listed on our site as well. So you click on the site, read down. We've had great connection with Mississippi Cannabis Trade Association. They've done some pretty cool artwork, and they've let us put on our site, so it's easy to get through, easy to read. We're open, we're available. Our clinic is in Ridgeland. We're open every single day between 9 and 2 o'clock. Someone is in the clinic. We don't do evaluations every single day, but someone's in the clinic gathering medical records, helping people through the portal, helping people navigate the Mississippi Department of Health website. So whenever you need anything, you give us a call, shoot us an email. If the office is closed, I know 2 o'clock is kind of early for a lot of people. Some people may be just waking up at 2 o'clock. But you shoot us an email, I guarantee you we're going to always respond.
All right, great. So, thank you for coming on, Dr. Kency. I really appreciate everything that you're doing. Thank you for being in the program, and thank you for just being a wonderful practitioner.
Appreciate you. Appreciate you. Don't forget, square pictures, square pictures,
Square
square
pitch.
pictures.
Oh yeah. Well,
All
this
right.
has been another episode of Burning Questions Podcast. My name is Melvin Robinson, Executive Director of the Mississippi Cannabis Trade Association. Make sure you follow us on YouTube and Facebook. Make sure you like us on there as well. If you need any more information or anything about the program, visit mscta.org and visit our resources panel. You can see the rules and regulations that's out right now, any kind of updates on that, any kind of updates that you need as far as infographics on how to actually get your card, anything like that. You can find that there. And again, thank you for watching. Y'all have